Coming up, what if I told you a simple dental procedure can have the same effect as a facelift?
My teeth totally suck. I don't like them at all. I totally feel self-conscious when I smile. I try not to smile. I try not to be in pictures. The perfect bite for me would be straight, white teeth. Wide, not broken, and not falling out of my mouth.
Welcome back. That was Kathleen, who suffers from health problems due to her bite, how her teeth line up. Well, guess what? Now there's also a beauty benefit from getting your bite fixed. Take a look at this.
Facelift dentistry procedure is a dramatic change in the face of the patient as a result of only doing dentistry. The natural process of aging is wear. And so our face begins to move down, our teeth begin to wear shorter, our bites begin to flatten, and our jaw begins to go back. Alan is a patient that came in and his bite is terrible.
It's very hard to eat because your teeth don't contact. So when you try to chew, it's kind of a struggle. It's difficult to smile sometimes because your jaws hurt all the time from all the pressure that you've exerted. Sleeping becomes difficult.
When he bites together where he wants to, his back teeth don't even touch. What we're going to do today is put in all your upper work. We're just placing them on the teeth. So what we're doing is we're sliding over the top of the teeth, and notice how they fit the gum really nicely. What Facelift Dentistry is designed to do is to give every patient the absolute best level of health care, getting rid of all disease, all decay, and gum infections. And second level is to reduce stress in the bite. By putting the jaw in the proper position, we are able to have that patient be far more comfortable, far more relaxed, function better, speak clearer. And then the third level is that the patient is going to look a lot better. We are at the final curing of Alan's teeth. We've put all the veneers in, and we've put the biting surfaces.
There was absolutely no pain. It was not painful at all.
Here to tell us more about this is Dr. Sam Lawson, a dentist from Santa Monica, California. Also joining us is his patient, Alan, who's right now in the process of improving his own bite. So this idea of facelift dentistry doesn't involve any plastic surgery, right?
Right. There is no plastic surgery, no Botox, no Restylane. All the work is done on the teeth to maximize the patient's jaw position.
And walk us through this animation that we have, if you would.
The animation covers roughly a 25-year-old girl who is getting gradually older. And you can see how cruel nature can be. I mean, the muscles are going bad, and the face begins to sag, the bite's getting worse, and everything just begins to deteriorate. And what the object of facelift dentistry is to completely reverse that.
And a lot of it also has to do with your overall health. So Alan's in the midst of all this, right?
Alan is at the halfway point. He's one of the few people that doesn't have a lot of decay and a lot of crowns and a lot of things in his teeth that are bad. So the level of health we're doing for Alan is repositioning his jaw and reducing all of the stress level that's in his face, his neck, and his jaw. So he's had trouble eating. He's had trouble just at rest. His jaw's hurt. Some people can get headaches. And so we tested it, and we put in the upper teeth last night.
And Alan, you're smiling. That's a good thing.
Yeah.
Very much, yes.
But Barbara is all the way through her treatments, right? So what did you do with Barbara?
With Barbara, she came in similar problem to Alan, and that was that she was not comfortable with her bite. She had a lot of stress within her face and within her neck, and some headaches and jaw soreness, and it was bothering her. And so she would actually show me where she wanted it to be, and what I did was build a test appliance similar to what I did for Alan. And after testing it, Barbara called in like 3 days. I'm ready.
And Barbara, how do you feel now?
I'm so happy, absolutely happy. I was in a lot of pain, but on top of that, I was more concerned with the aesthetic look. I had a receding jawline, and Dr. Muslin just got it down to exact science of where I wanted my jaw to be, so I'm over the moon happy.
And we actually have a before and after of you before the dental facelift. And that's a much more comfortable, easygoing smile. And so we touched upon this before, but a lot of health benefits to fixing that bite.
There's a lot of health benefits because there's a lot of stress reduction. The studies show you live longer if you're more comfortable and you're disease-free completely. No decay, no gum infection, complete and total oral health, and complete stress reduction.
And I'm going to show everyone a few more before and afters of patients who've had their bite fixed.
This is Andy. And you can see in the before picture, he's worn his teeth down and his face is collapsed. He has a short, round face, very typical of a 50, 60-year-old man. And with Facelift Dentistry, his jaw is now repositioned down. The shape of his face has changed. It's now longer and younger looking. This is Renetta. She has the exact opposite problem of Barbara, and that is that her jaw is forward. When she bites together, her jaw slides forward. By completely rebuilding her bite, we were able to get her jaw in a natural position.
Well, thank you all so very much. We appreciate it. Thank you, Dr. Lawson.